Well, our next guest is a member of that committee. Joining us now with reaction, Texas Congressman and Dr. Michael Burgess. Dr. Burgess practiced as an obstetrician gynecologist for 25 years. Dr. Congressman Michael Burgess, welcome to the show. It's good to see you. All right, so a lot of fear-mongering there, a lot of narrative around the fact that conservatives, Republicans do not care about the health of the mother, do not care about the mother's well-being. They only care about the baby. Your response?
But actually, none of that, of course, none of that is true. I practiced for 25 years, did not do abortions. The hospital I was in did not do abortions. The surgery center that I started did not do abortions. And yet, if someone needed treatment for a miscarriage, if someone needed treatment for an ectopic pregnancy, there's no question about it. They got the care that they needed at the time that they needed it. What is and I think it was telling in the hearing that we did hear from the one pro-life witness that we were permitted to have at the witness table. 92% of OB-GYNs are basically pro-life. That is, they do not do abortions. And so you're telling me that 92% of the workforce was not taking care of patients? I mean, it's just preposterous, and people know that it's not true.
So Democrats are also saying that now that Roe's overturned, that conservatives or pro-life doctors also don't want to give out contraceptives. They're trying to eliminate contraceptives in states. I haven't seen this. I have not heard any red state Congress or member or governor talk about this. Where are they coming up with this narrative?
It's, well, they're trying to use the shock factor in order to prevent the losses that are inevitably going to happen in November. So they're latching on to this. There are other issues that they're putting out there as they're trotting out as potential reasons why you wouldn't want Republicans in office. But look, no one's talking about this. No one is going to do this. They did do a bill in Rules Committee yesterday. I guess we'll hear it on the floor on Thursday, preserving the access to contraception. But the bill is so poorly written and, in fact, would preclude the FDA from being involved in decisions about what medicines to approve. So it's probably not a good idea. It will pass the House. It will go nowhere in the Senate. But this is the only narrative they have right now is to try to frighten people into voting for Democrats, because no one would vote for the type of incompetence that we've been seeing coming out of the White House right now.
Yeah, and a lot of these bills have been written in haste, written with broad brush terms, just because they're so fearful and they're trying to get a narrative for November. I do want to ask you about this because we had Vice President Kamala Harris address the NAACP yesterday, and here's what she had to say about Roe's reversal. Watch.
We know, NAACP, that our country has a history of claiming ownership over human bodies. And today, extremist so-called leaders are criminalizing doctors and punishing women for making health care decisions for themselves.
Your response to her comparing slavery to abortion?
Well, of course, she's way off base. And this is the same vice president who a couple of days ago said that unborn children were not actual people. So I mean, we've got to take it with consider the source here. Look, doctors want to provide care for their patients. That's the bottom line. As a pro-life OB-GYN, that is what I did for 25 years. I never felt that I was providing less than optimal care for my patients. But what I would not do was interrupt a normal, viable pregnancy. If the mother's life is threatened because a procedure needs to be done, of course you do that, but not the voluntary interruption of a pregnancy to destroy a life. Because abortion, when properly applied, has a 50% mortality rate at least.
Congressman Michael Burgess, appreciate what you're doing to speak up for life, and thanks for being here with us this evening.
Thank you so much.